Today we're going to be looking at treating babies and children with reflexology. So I'm going to use my PowerPoint slides. So if I just share my screen. Okay, so treating babies and children. Treating babies and children is actually no different to treating adults. You always adapt your treatments no matter who you're treating. But there's several general principles that you should think about when you're treating babies and children that should come into your mind first of all. So work within the child's comfort zone, get the child's agreement to the treatment, use a lighter pressure and a shorter treatment, no pituitary, just holding, no pain, work both feet together, don't always work all reflexes, use language the child understands, and place the child so that you and them are comfortable. So, work within the child's comfort zone. Children may be worried about having reflexology, so it's important to take as much time as you need to ensure they're comfortable with what's going to happen. And what you need to do is make sure they understand exactly what's going to happen. You don't just grab their feet or their hands. Quite often I'll ask the parents to bring a teddy and I'll demonstrate the reflexology on the teddy, and then I'll get the child to actually do a little bit of reflexology on the teddy as well, and that's really good. If you've got really young children, especially if they're your own child, get them to watch a video if they're at all and happy about sitting still. And what you generally find is, although they'll watch the video to start with, they'll soon get relaxed and actually just nod off. If it's your own child, you can also get your child to give you reflexology, and that really helps them understand what's happening. Get the child's agreement, it's really important. Mostly they didn't choose to come and see you, so only carry on with the treatment if the child agrees. I often get children to sign their own consultation form, and I get the parent to countersign if the child is under 14, which is the age a lot of doctors and hospitals will allow children to choose about, make decisions about their own treatment. But if you're more comfortable using 18, that's absolutely fine. Yeah. Generally give the child a lighter treatment. So if it's their first treatment, then definitely reduce your pressure. If they have reflexology a lot, then you might not need to reduce the pressure. So when my daughter was a tot, she used to come to a lot of the assessments, and if a reflexologist gave her light short treatment, she really wasn't very impressed. Because she'd had lots of reflexology, she actually wanted a full treatment. Even from when she was sort of 9, she wanted a full treatment, and she wanted a moderate pressure. So certainly reduce pressure initially, but then work with your client. They're just like any other client. Shorter treatment. So if this is the child's first treatment, you should give them a shorter treatment. So these are just starting figures to have in your head. So babies, 10 minutes, toddlers, 15 minutes, infant school, 20 minutes, teenager, this can be anything from 30 minutes to a full treatment. But again, if your baby or your toddler is really enjoying it, there's no reason why you shouldn't just carry on treating. Don't hold the pituitary. You don't want to put them off reflexology forever, so just hold the pituitary. And don't have any pain in the treatment at all. Even if you think they might need a deeper treatment, they've got really bumpy shoulders, their adrenals are really imbalanced, go within what your client wants. So for children, there's no pain ever. Work both the feet together. So relax the right foot, relax the left foot, work the toes on the right foot, work the toes on the left foot, work the ball of foot on the right foot, work the ball of foot on the left foot. And you do this because if the child wants to finish the treatment early, at least you'll have left them balanced. Now, as you go along and children have more treatments, you just might go, we'll work all the right foot and then we'll work all the left foot, because you know the child will sit still and enjoy the whole treatment. But initially, work both feet together. As I say, it just leaves them balanced, whatever happens. Don't always work all the reflexes specifically. So you need to build up working the reflexes depending on the age of the client, but you're still doing caterpillar all over the foot. So you are working everything. You're not concentrating deeply into any of the reflexes. So for a small baby, you do relaxation, caterpillar the toes, caterpillar the whole of the sole of the foot, normally in 3 or 4 different directions. Caterpillar the colon, which works really well for babies, caterpillar the medial, lateral and dorsal aspect of feet, and carry out relaxation. So you've covered the whole foot, but you've really only worked the sinuses and the colon specifically. Okay, so even if you're just caterpilling the whole feet, you are working the reflexes. If you're treating a larger baby and their feet are a little bit bigger, so you would actually break down the foot so that you're caterpillaring the balls of the foot and then the arch of the foot and then the heel area. And so this means you're actually working the chest area, pelvic area, colon and sinuses specifically. A preschooler, you might start working the shoulders and the lungs separately. So you're just building up what you're going to be able to work. Children's reflexes are smaller. So if you're treating a child in key stage 1, you should be able to work most of the reflexes, but not the really small ones such as the pituitary, gallbladder and reproductive reflexes. But you can still caterpillar over them, which is working them. By the time the child's in key stage 2, you should be able to get to all of the reflexes. Don't always work the reproductive organs. They're not doing a lot until the child is approaching puberty. So just leave them. There is a stage when the child might have some symptoms associated with puberty, and you really want to work the pituitary really well because it will help them. But you've just got to work as deeply as the client will let you. So have that discussion with the client. You're better just holding the pituitary rather than putting the client off, even though you know actually your gut's saying I need to go into the pituitary for this child. If you put them off, you're not going to benefit anyone really, because they won't want another treatment. So if you can work a little bit more deeply once the child starts to get puberty symptoms and they're struggling with them, then do so. Make sure that the child understands you, and that might be just eye contact for the baby, so that you're saying, yeah, I'm not threatening, or just changing the way you speak. So I was listening to a student in their assessment giving aftercare advice to a little tot, and they said that reflexology makes you thirsty and sleepy. So it's really important to drink lots after a treatment, and it's fine if you want a nap. And I just thought that was a really good way of talking about reflexology. Oh, position you and the child. This is actually the hardest bit about treating children. So with babies and small children, I like the parent to hold the child, and then if I'm sitting next to them, I've got access to their feet. With a slightly larger baby, you can do this, put the parent in the lafuma, have the baby in their arms, but give them lots of pillows to make sure they're comfortable, and you're working from the side of the parent. If the baby isn't a client, you can hold the baby with you sitting either on a chair or sitting up against a sofa, with their head near your knees, and then their feet are there for you to work. I've also treated family babies in car seats and high chairs, although this doesn't allow them to relax as much. So, but there's certainly the car seat works really well. Toddlers and preschoolers, they're still too small for the lafuma, so it's either getting a parent to hold them as with a baby, or lying them on a massage couch with pillows to make sure they don't roll over, and a parent to hold them to make sure they don't roll off. So that's really important that the child is safe. The parent can be sitting next to the massage couch, and so they're quite comfortable. If you don't have a massage couch, a kitchen table works really well. For non-client children, again, on the floor with your back against the sofa and the client lying on the floor with their feet in your lap still works. So they can either be on your legs, or you can make your legs into a V, and then they'll have a cushion under them. That works really well. Key stage 1 children is probably the hardest to treat, to get yourself comfortable, because they are too small generally for the lymphoma, but actually they're too big to sit in their parents' arms. So you've really just got to improvise, depending on how big the client is. Key stage 2 children generally are big enough for the lymphoma. There's an in-between stage when they're not quite big enough, and if you put some pillows behind the client, that works well. But don't forget that will move the centre of gravity for the chair, so you won't be able to keep the feet end up unless you've actually rested them on your knees, but actually that's not a big issue. So go with your gut. Children are just the same as you and me, but smaller, and they can benefit from reflexology in exactly the same way as an adult does. If a baby's not settling, they're not sleeping, reflexology can be really effective. If they have got constipation, that's again, it can be really effective. Children from the age of probably 5 start getting bumpy shoulders, which is actually really sad, but that's the way it is, because we probably make them sit for too long at school rather than letting them run around. So, you know, if you think about a 5-year-old sitting when they're used to running around all day, their shoulders will be bumpy. You might start to feel a few bumps on their lower back. School can be a frightening time for children. So if you look at children going into senior school, lots of work on the adrenals, on the solar plexus to help them relax. So children, yeah, just go for it. You can do it. Thank you.